how do we address the biochemical components of addiction recovery. Because it's unique, the biochemical traits following an addiction. Let me just see. So today's takeaways, we're going to cover beyond calories and vitamins, cause of malnutrition in addiction, and I'll be touching on cross-addiction as it relates to food, and also superfoods in recovery to restore biochemical balance, and how do we apply the nutrition strategies into recovery, and also I'll recap with the nutrition treatment intervention key points. The case for nutrition intervention in recovery was actually already proposed in 1990 from the American Dietetic Association in their position paper, but still, if you go to most treatment centers today, it's actually a patch-on program rather than being integrated into their protocol of standardized how do we actually treat the biochemical traits following an addiction in order for the person to not just be sober, but to actually thrive beyond recovery. And that is a major issue from my point of view that we need to understand. How do we actually get people out of a facility so that they thrive in the body they're in? Because addicts, just like eating disordered people, have a very bad body image. They have difficulty being in the body they're in. And a lot of this, I mean, this is only one aspect to it, but a lot of this is biochemical based that can be addressed and targeted with a tailored nutrition program. It's not just about being sober, because what are you going to be sober from? They're using drugs or they're eating disordered behavior to numb themselves out from something they don't want to feel. And I mean, this is going more mainstream. This was a recent article in the popular online magazine, The Fix, Nutrition and Recovery, How Healthy Eating Can Help You Stay Sober. They also made studies on how fish oil actually helps to increase the odds of breaking an alcohol addiction. And it is because nutrition addresses this neurotransmitter pathways and can be used to restore them. So again, I mean, everyone here knows that addiction is a disease of the brain reward system. And the key here is to understand that the brain is plastic. You're not an addict for life. You can actually change the structure of the brain through exercise, nourishment, and training. So my point of view today is going to focus on nourishment aspect. How do we change the brain through a targeted nutrition approach? Also worth mentioning is that when we work with changing food patterns in addiction settings, you don't do it cold turkey. You don't do it like putting them on a diet, because change does not happen outside our comfort zone, which is, we are often told, it happens at the edge of our comfort zone. Unfortunately, with drugs, we haven't really developed much of a step-down model. I mean, I know there are certain medications that we use to do sort of a step-down model, but usually they just go sober, and that is definitely outside their comfort zone. So any other change also with a targeted nutrition intervention must be done in micro steps, so it doesn't stress them out. Yeah, so what are the primary health concerns that we see in addiction? It is oral, it's gastrointestinal, it's metabolism, it's circulatory, and it's neurological. I want to emphasize gastrointestinal because if you're not focusing on restoring their gut health following an addiction, whatever they're eating, even if it's great, nourishing foods, they cannot absorb it. We are not what we eat, but we are what we absorb and can utilize in order to rebuild the other parameters that are out of whack, like their circulatory and their neurological health. And I mean, I'm sure all of you or most of you know about the gut-brain connection, so that's just the basis for that. And also when I'm talking about addiction and a nutrition intervention for that, we're also talking about food addiction and understanding that food addiction is not just like when we go and eat maybe 6 donuts following a breakup or whatever. It's not the socially or environmentally based triggers, but some binge eaters actually experience this physical craving that is beyond just comfort eating. We see this especially in an eating disorder like bulimia nervosa, where they're consuming huge amounts of specific types of foods, and it's not even foods, but it's substances in those foods that are altering their brain chemistry to mimic that of an addict. So it's also important, are we actually treating someone with addiction, or are we treating someone with an eating disorder? Because if you're just treating someone with an eating disorder who actually has an underlying addiction, they cannot get to the next step because their biology is against them. They're so addicted to, in this case, food. And again, that's where you focus on addressing the biochemical imbalances at play driving the disease. And we see this quite often also in recovery, that we're shifting from one drug over to food, or we see it like shifting from nicotine to food as a drug of choice. And nicotine is a very interesting substance because it both affects serotonin and dopamine. So they're so wired to compensate with food afterwards because it's both reward pathways that they're set up to crave. So it's also, I mean, just when we send these people out from our rehabs, are they recovered, or did they just cross over to another more socially acceptable addiction that we're not picking up? Usually, in a lot of the rehabs that I sometimes visit, if I'm talking about nutrition, they will have sugar available en masse, and they will have junk food available en masse. And this just means that they may be sober, but they're consuming things that are still tapping in the same reward centers in their brain, and that sets them up for easy relapse because they're keeping that pathway alive. And that's the problem. It's not about supporting the donut industry. So again, we see the same addiction cycle, whether it's food or drugs. There's the trigger, there's the craving, there's the ritual, there's the using, there's the guilt. So it's not that food is addicting, but it is that the highly processed and palatable byproducts are. What are the addictive substances in food? Well, we're talking about MSG, we're talking about chemicals, caffeine, casein, gluten, sugar, artificial sweeteners, high fructose corn syrup. And it's also interesting that, I mean, when people exit rehab, a lot of Hollywood starlets, you always see them almost with caffeine, Starbucks drinks in their hand when they're not in rehab, because it is tapping on the same reward center. So these are just kind of relapse waiting to happen. They're not recovered. They're just kind of cross-addicting while they're out, waiting for a relapse. A thing to mention here regarding sugar is, of course, you're not going to get an addiction from just adding some sugar to your tea. It's the dosage that makes the poison. That said, people who are exiting rehab, they're going to be more sensitive to things that are tapping on the same reward system in the brain. And that can lead them back into drug addiction because the brain kind of remembers the feeling and wants the feeling intensified, so they go back to the drugs. Yeah. And again, I mean, alcohol, it's just grain in a form of sugar, and we see this because many alcoholics actually has an earlier and primary addiction to food that predates the alcohol addiction, or for many bulimics, their secondary drug of choice is alcohol. So it's really also important when you're addressing the underlying biochemical imbalances to understand what predates the current addiction. Did they actually have another type of addiction going on before what they came in to be treated for? Because otherwise they're going to relapse back into that when they're sent out. Another thing I want to touch on is just we see different eating behaviors in drug addiction, like in meth. When you have ghrelin, this is the hunger hormone, it actually gives a better high, and that's why we often see anorexia in combination with meth. Where do we see overeating in drug addiction? Well, we see it in opiate addiction, the desire for especially sugar, starches, fat, the beta endorphin spike or natural painkillers. In coke addiction, it's typically going to be a desire for fatty foods. In nicotine addiction, it's going to be a desire for carbs. So this is key points to pick up when you have a client in rehab, to understand what are they going to try to get hold of, maybe even unconsciously, to compensate for the pain of being sober. Because again, it's hitting the same reward system, and that makes them sensitive to relapse. You want to restore the biochemical balance, not substitute the addiction. And not just that, but I mean, if they're gaining a lot of weight in recovery, the body image in recovery is notoriously bad. These are people who cannot be in their body. So somehow we need to also monitor their weight gain in recovery so it doesn't get too much too soon, because that also sets them up for eating disorder behavior, to try to control their weight or to relapse, to manipulate their weight down with drugs. So about marijuana, which is being legal more and more places now, while it's not physically addictive, it clearly is psychologically, and it does triggers the munchies. So regardless of what the future aspect is for marijuana, my take on it is that for the food addict, marijuana is going to be a ticket to relapse, because it does minimize or resistance to acting out behaviors. Someone was talking about it as being used for a step-down drug model, and I thought that was interesting, so maybe I'll change my mind. But right now, it's definitely something that needs to be addressed. Just to recap here, the 4 nutrition healing steps that should be part of a protocol is obviously you detox of addictive substances, then you focus on repairing the gut, and then you focus on digestive restoration, meaning activating the production of enzymatic of bile for the person to actually break down carbs and fat and protein. And then you can focus on biochemical balancing, restoring the building blocks, the neurotransmitters, the communication, and reward that has been out of whack. You cannot do that from the get-go, because again, the gut repair must be done prior to that. And here is just an overview of the biochemistry of an addiction. Typical biochemical parameters that are out of whack. We're looking at parameters like insulin, cortisol, ghrelin, leptin, dopamine, serotonin, and beta endorphins. These are all things where what we eat will have an impact on either providing the building blocks or deteriorating them. And that's also why no diet fits all, and we all react differently depending on what we eat. It depends on how our body is wired. But these are things that are out of whack following an addiction, and that needs to be targeted with a tailored nutrition intervention. And just, a note about the neurotransmitters. Even if you don't, I do neurotransmitter testing with my clients, but when we look at deficient dopamine, what we see is addictive eating. Deficient serotonin is typically comfort eating. It's the nighttime binger. Deficient GABA is going to be anxiety eating. And it becomes very obvious when people tell about their struggles with food and just in general how they respond to everyday stressors, what neurotransmitter is at play, and also different drugs drive different neurotransmitters. And this is just interesting, looking at how quick the wrong diet can lead to a relapse. This is a case of, they did it with bulimia nervosa, the most addictive eating disorder, where a tryptophan depletion led to symptomatic relapse within 24 hours. And these were finished treated patients. But when the nutrition was not targeted to give them a biochemical balanced brain, they relapsed within 24 hours. And it's just to say that what is an addict going to do if they're not eating to stabilize their neurotransmitter? They're going to go back to the drugs. And I mean, why are we seeing more women with eating issues? But this would go for addicts as well, because addiction and serotonin imbalances go hand in hand. But still, we see women have 52% serotonin of men in general, so they are more vulnerable to extreme types of dieting behaviors than men are. They don't have a lot of buffer zone for that. And you can raise serotonin with food. I mean, whey is scientifically proven to raise serotonin levels within 2 hours. So going over some superfoods in recovery, I want to mention ashwagandha, and this has a direct impact on hormones that I mentioned, like cortisol, and it helps to rebuild the nervous system. It's an adaptogene, so it's kind of a smart herb that understands what the body needs in order to balance. Gotu-kola is nervine. It has an impact on anxiety and appetite regulation. It helps to calm the mind. And it also binds to CCK, the appetite hormone. Chamomile, valerian, all these other herbs, and saffron even proven more efficient than antidepressants in Western science. So this is not just kind of intuitive wisdom from Ayurveda, but this is actually proven with the references or at the end of my slides. But what's interesting here with these things are that even though we're beginning to be able to prove this with Western science, they have done this for thousands of years in Ayurveda. And it just goes to show that what we are discovering in the West is really very young. We don't know a lot. We don't know a lot of how to treat addiction. We don't know a lot of how to use plant medicine over the money industry-based medicine. Other things I just want to quickly touch on is like carrot juice. I mean, carrot juice is interesting because it's molecularly similar to healthy blood. And what does that mean? It means that with every disease, usually you can see changes in the blood chemistry. So carrot juice helps to clean out your blood and mimic as if you're getting healthy blood transfusion. Red meat is a great source of tyrosine, especially for addictions where they have been taking dopamine hitters, because red meat, the tyrosine is a building block of dopamine. So a vegan diet following an addiction is often not a very good idea because it's going to be very low in tyrosine. And if they've been taking drugs that hit dopamine, where are they going to get the building blocks from in a vegan diet? Ghee, again, this is clarified butter. It just helps to coat the gut, the stomach lining. So I use it, we use it for restoring gut health, to actually enable people to absorb the therapeutic nutrition. Yeah. And I mean, we all know about fish oil, brain health, nervous system, reproductive hormones, and it's also been shown to improve the odds of breaking an alcohol addiction, works on the serotonic synapses of the brain. I mentioned this, but it's just that Eastern medicine overlaps with Western science. And I mean, even recently they published a study where curcumin was shown to be more efficient than 14 drugs. So this is not just like intuitive wish-wash. We actually now have proven what they have just been doing for thousands of years. And it's the whole body-mind-soul connection that we're just trying to get back to. So how do we apply this in recovery? Well, avoid diet extremes. Vegan depletes dopamine. High protein depletes serotonin. Gradually reduce stimulants. Gradually reduce food substances that mimic drugs. And you want to do this gradually because anything that's done too quick is going to go out of their comfort zone, so they're going to relapse. Include superfoods in recovery to rebalance the body and brain health, and hydrate. So the intervention key points, just to recap what I touched on: food and drugs compete for overlapping reward mechanisms. After substance abstinence, there's likely going to be an increased drive for food, and there's going to be a waking up of the appetite again because the hypothalamus is waking up. So they're going to experience most likely that their hunger is out of control. So this needs to be taken into account. Both food-wise, how do we restore normal ghrelin-leptin levels, and also therapeutically, how are they going to handle their emotions without numbing themselves out with food addiction now. So again, minimize exposure to highly palatable foods. If it's not grown in the ground, basically the chemicals, the stimulants that we add to these packaged foods nowadays are going to be more like a drug for a recovering addict than for us who don't have that history of ourselves remembering what that hit felt like. Yeah, and monitor weight gain just due to counter-hormonal adaptations, and then you can focus on also the gut, hormones, and brain chemistry. Those are the three aspects in order to make for someone who truly thrives beyond recovery, body, mind, and soul. So that is it, and if anyone has a question, you can talk to me on info.christina@santini.com.